Have you ever found yourself feeling constantly exhausted despite getting enough sleep, or occasionally running a mild fever with no clear reason? Some people experience joint pain, facial rash, or unusual hair loss. These warning signs are often overlooked, dismissed as simply getting old, feeling weak, or a minor inflammation. But in reality, they could be signals of a serious disease: systemic lupus erythematosus. Lupus is called the master of disguise because its symptoms are so varied and easily confused with dozens of other illnesses. According to the Lupus Foundation of America, more than 5 million people worldwide are living with lupus, and in the U.S. alone, about 1.5 million people are affected. What's worrying is that it often takes an average of 6 years for a lupus patient to be accurately diagnosed, since the early symptoms are vague and misleading. Kidneys, heart, lungs, joints, brain, even the skin. Lupus can attack nearly any organ in the body. Without timely detection and treatment, lupus may lead to severe complications, even life-threatening ones. The good news is that if recognized early, patients can control the disease, prevent flare-ups, and maintain a near-normal quality of life. In today's video, I will share with you the 10 most common symptoms of lupus based on scientific data from Mayo Clinic, Johns Hopkins Medicine, and my real-life experiences supporting patients across the U.S. Each symptom will come with a clear explanation, a real patient story, and important notes so you can recognize and prevent them. Remember, the earlier symptoms are detected, the better the chance of controlling lupus. Especially make sure to watch until the end, because symptom number 10, kidney damage, is one of the most dangerous complications, silently progressing toward kidney failure. Before we begin, if you find this topic important, please consider subscribing to the channel and enabling the notification bell. Comment number 1. If you'd like me to make more videos about autoimmune diseases, or number 0 if not yet. Every bit of support from you is my motivation to keep bringing practical and accessible health knowledge to our senior community. Now let's start with the first symptom: persistent fatigue, and learn why lupus makes the body so easily exhausted. Symptom 1. Persistent fatigue. Fatigue is the most common symptom in lupus patients. Unlike tiredness from heavy work or lack of sleep, the fatigue in lupus is systemic and long-lasting. It does not improve even after adequate rest. The primary reason is chronic inflammation within the body. The immune system attacks its own tissues, releasing cytokines that create a persistent feeling of exhaustion. In addition, anemia, sleep disturbances, and side effects from medication also contribute to this overwhelming tiredness. According to the Lupus Foundation of America, up to 90% of lupus patients have experienced severe fatigue. Many report that this symptom affects their quality of life more than joint pain or skin rash. I once worked with Susan, a 70-year-old woman from Texas. She told me that she used to be very active tending her garden and walking around her neighborhood every day. But when lupus began, even simple household chores left her drained, forcing her to lie down for hours. This made her feel sad and frustrated, as though she had lost her independence. Tests revealed that her inflammatory activity was high, along with mild anemia, the key reasons behind her fatigue. In her care plan, our treatment team encouraged Susan to distribute her energy wisely throughout the day, handling heavier tasks in the morning and allowing time for breaks in between. She was given supplements including iron, vitamin B12, and folic acid to help correct her anemia. At the same time, she practiced light yoga and meditation to improve sleep quality. After 8 weeks, Susan reported significant improvement. She could shop for groceries, cook meals, and resume short afternoon walks. The key message is this: persistent fatigue without a clear reason lasting for weeks is an important symptom of lupus. Do not dismiss it as simply a sign of aging. If this condition occurs in conjunction with joint pain, a skin rash, or an unexplained fever, you should consult a doctor immediately to rule out lupus and other autoimmune diseases. Symptom 2. Joint pain and swelling. Joint pain is one of the most common signs of lupus. The pain often appears in small joints such as the fingers, wrists, or knees, accompanied by mild swelling and stiffness in the morning. Unlike rheumatoid arthritis, joint inflammation in lupus rarely causes joint deformities, but it lingers, making movement difficult. The root cause lies in the immune system attacking the lining of the joints, resulting in inflammation and the release of chemical mediators that trigger pain. Data from the Johns Hopkins Lupus Center shows that more than 80% of lupus patients have experienced noticeable joint pain at some stage. A typical feature is that the pain tends to move around. One day it may be in the wrist, and the next day it shifts to the knee or ankle. I recall the case of David, a 68-year-old man from California. He loved playing golf, but in recent months his hands had hurt so badly that he could no longer hold a club. At first he thought it was due to aging or simple osteoarthritis. But when a mild fever and a rash on his face appeared alongside the pain, he decided to see a doctor. Eventually, he was diagnosed with lupus. During treatment, David was prescribed anti-inflammatory medication by his doctor. Alongside medical therapy, I guided him to apply warm compresses in the morning to reduce stiffness and to practice gentle stretching exercises to maintain flexibility. His diet was also adjusted to include foods rich in omega-3 fatty acids such as salmon and flax seeds, which naturally help reduce inflammation. After 10 weeks, his pain had decreased significantly and he was able to return to the golf course several times each month. One important reminder: when joint pain persists or recurs, especially if accompanied by swelling fever or rash, it should not be dismissed as ordinary arthritis. It may be a sign of lupus or another autoimmune disease. Seeing a doctor early and getting blood tests can help identify the exact cause, leading to timely and appropriate treatment. Symptom 3. Butterfly-shaped rash on the face. One of the most characteristic signs of lupus is the butterfly-shaped rash. This reddish rash spreads across both cheeks and the bridge of the nose, resembling the wings of a butterfly. It may suddenly appear after sun exposure or during a flare-up of the disease. A key feature is that the rash usually does not itch or peel, but it lingers for weeks and is difficult to hide. According to the Mayo Clinic, about 50% of lupus patients develop this butterfly-shaped rash at some point during the course of their illness. Besides sunlight, emotional stress and hormonal changes can also trigger the rash. Importantly, this is not just a cosmetic issue on the skin. It is a strong warning that lupus activity inside the body is increasing. I remember Linda, a 66-year-old woman from Arizona. She loved gardening, but after spending a few hours in the sun, her face turned bright red with a distinct rash across her cheeks. Thinking it was just sunburn, she ignored it. However, the rash did not fade and actually spread further. When she finally went to the doctor, she was diagnosed with lupus, and that facial rash turned out to be the very first clue. In her care plan, I advised Linda to limit sun exposure between 10 a.m. and 4 p.m. Always apply sunscreen with SPF 50 or higher, wear long-sleeved clothing, and use a wide-brimmed hat when outdoors. To reduce skin inflammation, she also used fragrance-free moisturizer and topical medication as prescribed. After 6 weeks, the rash on her face improved significantly and she felt more confident interacting with friends again. The important message here is this: the butterfly-shaped rash is not just a simple allergy or ordinary sunburn. When the rash appears repeatedly, lasts for weeks, or accompanies fatigue, joint pain, or a mild fever, it is essential to see a doctor for a lupus evaluation. Early recognition helps prevent serious complications and allows patients to maintain their quality of life. Symptom 4. Sensitivity to sunlight. One of the most troublesome symptoms for people with lupus is sensitivity to sunlight. Even with brief sun exposure, a patient may develop rashes, burning sensations on the skin, and sometimes fatigue or mild fever. The underlying reason is an abnormal immune response that overreacts to ultraviolet UV rays, triggering inflammation and causing lupus flare-ups. According to the Lupus Foundation of America, up to 70% of lupus patients experience photosensitivity. This often forces them to make major adjustments to daily habits, limiting outdoor activities and avoiding social events. The impact is not only physical but also emotional, as many patients feel restricted and isolated. I once worked with Mark, a 72-year-old man from Nevada. He loved fishing outdoors, but after just one morning under the sun, his face and arms turned red, covered with small rashes. At first, he thought it was just a sun allergy. But when the reaction repeated several times along with joint pain and fatigue, he went to the hospital. Blood tests confirmed that he had lupus. In his care plan, we guided Mark to always apply sunscreen with SPF 50 or higher, wear long-sleeve shirts, wide-brimmed hats, and sunglasses whenever he went outside. He was advised to schedule outdoor activities in the early morning or late afternoon when UV intensity is lower. Since he needed to avoid direct sunlight, we also ensured that he received enough vitamin D through a balanced diet and supplements prescribed by his doctor. After 8 weeks of following these adjustments, his skin flare-ups were much less frequent. Importantly, he was still able to enjoy fishing, but in a much safer way. The key takeaway is that photosensitivity is not simply fragile skin or a common allergy. If even brief sun exposure causes redness, rashes, fatigue, or joint pain, it is essential to consult a doctor to rule out lupus. Early recognition allows patients to continue outdoor activities safely without the constant fear of triggering the disease. Symptom 5. Unexplained fever. Fever is the body's natural reaction when fighting infection. However, in people with lupus, fever often arises not because of bacteria or viruses, but because the immune system mistakenly attacks healthy tissues, causing inflammation and raising body temperature. Unlike fevers caused by the flu, lupus-related fevers are usually mild to moderate, ranging from 99.5 to 101.3 degrees Fahrenheit, 37.5 to 38.5 degrees. They can persist for days and are often accompanied by fatigue, joint pain, and rashes. According to data from the Johns Hopkins Lupus Center, about 50% of lupus patients experience unexplained fevers before being diagnosed. This symptom is easy to dismiss, as many people mistake it for minor infections or stress delaying proper detection of lupus. I remember Maria, a 69-year-old woman living in Florida. For 2 months, she repeatedly had low-grade fevers in the afternoons, along with fatigue and poor appetite. Her family assumed she had throat infections or seasonal flu, but antibiotics made no difference. When she finally went to the hospital, blood tests showed positive AA antibodies and high inflammation markers. Eventually, she was diagnosed with lupus. In her care plan, I guided Maria to rest adequately and drink warm water and light broth to avoid dehydration during fevers. She was prescribed anti-inflammatory medication according to her doctor's treatment protocol. In addition, I encouraged her to practice slow breathing meditation for 10 minutes daily to help manage stress, a common trigger for lupus flares. After 6 weeks, her fevers subsided, her health stabilized, and she regained both appetite and energy. A crucial reminder here is that when a fever lasts for several days, does not respond to antibiotics, and especially when it occurs alongside joint pain, rash, or fatigue, it could be a sign of lupus. If you or someone you know experiences this, it is crucial to seek medical care for blood tests and evaluation of possible autoimmune conditions. Symptom 6. Hair loss. Hair often reflects overall health. In patients with lupus, diffuse hair loss or patchy bald spots are fairly common symptoms. The cause lies in inflammation of the scalp, where the immune system mistakenly attacks hair follicles. This makes hair fragile, easy to break, and in some cases unable to regrow. Additionally, medications used in lupus treatments such as corticosteroids and immunosuppressants can contribute to hair thinning. According to the Lupus Foundation of America, up to 70% of lupus patients experience hair loss to varying degrees. For many, this is not only a cosmetic issue but also a psychological burden, making them lose confidence in social situations. I recall Carol, a 67-year-old woman from New Jersey. She had always been proud of her thick hair, but within just 3 months, she lost so much that patches of her scalp became visible. At first, she thought it was simply due to aging. But when combined with facial rash and joint pain, she finally went to see a doctor. Blood tests confirmed that she had lupus. As part of her support plan, I advised Carol to use mild sulfate-free shampoos and to moisturize her scalp with natural oils. She was also prescribed medication to control inflammation and was supplemented with biotin zinc and vitamin D to nourish hair follicles. To further protect her scalp, she made it a habit to wear a wide-brimmed hat whenever she went outside. After 10 weeks, her hair loss slowed significantly and new baby hairs began to grow, restoring her confidence. The key point is this persistent hair loss that does not improve with ordinary care, especially when accompanied by rash, fatigue, or joint pain may be a sign of lupus. If such symptoms occur, it is essential to consult a doctor for a proper evaluation and timely treatment. Symptom 7. Mouth or nose ulcers. Mouth ulcers or nasal ulcers are a distinctive yet often overlooked symptom of lupus. These sores are usually small, shallow, and either mildly painful or completely painless. They appear on the lining of the mouth gums or inside the nose. They develop as a result of autoimmune inflammation affecting mucous membranes, often made worse by dry mouth and side effects from medication. According to the Johns Hopkins Lupus Center, up to 40% of lupus patients develop mouth or nose ulcers during periods of disease activity. For doctors, this symptom is particularly useful in making a diagnosis since it helps distinguish lupus from other joint or skin conditions. I remember Nancy, a 70-year-old woman from Ohio. She often had small sores inside her mouth, which she initially thought were just canker sores. But the ulcers kept coming back, lasting for weeks at a time, and were accompanied by fatigue and joint pain. When she finally went to the doctor, blood tests confirmed lupus. In her case, those recurring ulcers played a crucial role in an early diagnosis. In her care plan, I guided Nancy to maintain good oral hygiene by using gentle alcohol-free mouthwash and avoiding spicy or acidic foods such as oranges and lemons. She was prescribed topical anti-inflammatory treatment, and I encouraged her to drink plenty of water to reduce dryness in the mouth. After 6 weeks, her ulcers had healed faster and their frequency had decreased noticeably. The important message here is this: recurrent mouth or nose ulcers that linger and do not resemble ordinary canker sores should not be ignored. If these sores appear together with fatigue, joint pain, mild fever, or skin rash, they may signal lupus. Seeking medical attention early enables doctors to diagnose lupus more quickly and provide effective treatment. Symptom 8. Chest pain and shortness of breath. Chest pain and shortness of breath are concerning symptoms in people with lupus. The most common cause is pleuritis, inflammation of the lining around the lungs triggered when the immune system attacks healthy tissue. In some cases, lupus can cause pericarditis, which is an inflammation of the sac surrounding the heart. Both conditions may lead to sharp chest pain when breathing deeply or lying down. These episodes are often accompanied by tightness in the chest, rapid breathing, and fatigue, creating anxiety similar to that of a heart attack. According to the American College of Rheumatology, about 30 to 50% of lupus patients experience complications involving the lungs or heart with chest pain and shortness of breath as early warning signs. This is a symptom that requires careful attention because ignoring it may result in pleural effusion or chronic pericarditis. I remember Robert, a 71-year-old man from Illinois. He often felt sharp chest pain whenever he climbed stairs along with shortness of breath. His family feared he was having heart problems and rushed him to a cardiologist. After several tests, doctors discovered that lupus was the true culprit and pleuritis was causing his symptoms. In his care plan, I advised Robert to avoid overexertion and instead practice slow, deep breathing exercises to expand lung capacity. He was prescribed anti-inflammatory medication according to his doctor's recommendations. To lower his risk of infections which could further complicate lung or heart conditions, he was also encouraged to receive flu and pneumonia vaccinations. After 8 weeks, Robert's chest pain and shortness of breath had eased considerably. He was able to take daily walks around his neighborhood without fear or discomfort. The key message is this: recurring chest pain and shortness of breath should not be dismissed as simply weak lungs or ordinary aging. In lupus patients, they can signal pleuritis or pericarditis. Early medical evaluation is crucial for detecting and treating the problem, thereby preventing potentially dangerous complications. Symptom 9. Brain fog. Brain fog is how many lupus patients describe difficulties with memory focus and clear thinking. They may forget simple things such as where they left their belongings, or they may take much longer to complete everyday tasks. The underlying causes include chronic inflammation affecting the central nervous system, as well as fatigue, poor sleep, and side effects from medication. According to research from the National Institutes of Health (NIH), about 50% of lupus patients experience brain fog at some point, with severity ranging from mild forgetfulness to more noticeable cognitive impairment. Though silent, this symptom greatly impacts quality of life as it often lowers self-confidence and increases dependence on others. I recall Janet, a 72-year-old woman from California. She complained that she had recently been forgetting her daily routines, and sometimes while cooking, she could not remember whether she had already added certain ingredients. Her family worried that she might be developing dementia. But when combined with her other symptoms, such as fatigue and joint pain, tests revealed that lupus was the cause. In her care plan, I encouraged Janet to establish a structured daily routine and write down tasks in a notebook. She also engaged in light brain training activities such as puzzles and reading. To improve focus, she practiced morning meditation for 10 minutes and maintained gentle physical activity to enhance blood circulation to the brain. After 8 weeks, she reported feeling clearer, less forgetful, and more confident. She even rejoined her community book club with enthusiasm. The important point is this brain fog is not merely age-related forgetfulness. When it occurs in conjunction with fatigue, joint pain, a skin rash, or an unexplained fever, it may be a sign of lupus affecting the nervous system. Early detection allows patients to receive timely support and prevents confusion with dementia or other neurological conditions. Symptom 10. Kidney damage, lupus nephritis. The kidneys are vital organs that filter waste and maintain fluid balance in the body. When lupus attacks the immune system, can inflame the glomeruli, the filtering units of the kidneys, a condition known as lupus nephritis. This is one of the most serious complications of lupus because if not detected early, it can progress to chronic kidney failure. Typical warning signs include swelling of the ankles or feet, foamy urine due to protein leakage, and sometimes blood in the urine. Patients may also experience sudden weight gain due to fluid retention accompanied by fatigue and high blood pressure. According to the National Institute of Diabetes and Digestive and Kidney Diseases, NIDDK, Up to 40% of people with lupus will develop kidney involvement during the course of their illness. I recall Henry, a 70-year-old man from Michigan. He came to the clinic because of significant swelling in his legs, heavy eyelids in the morning, and foamy urine. At first, he thought it was just a result of eating too much salt, but lab tests revealed proteinuria and elevated blood creatinine, clear signs of early lupus nephritis. In his care plan, I collaborated with the medical team to guide Henry in reducing his intake of salt and animal protein and replacing them with fish, vegetables, and whole grains. He was prescribed medication to control blood pressure and protect kidney function. We also encouraged him to monitor his urine output and weight daily to quickly detect fluid retention. After 12 weeks, his swelling decreased, his blood pressure stabilized, and lab results showed a reduction in protein leakage in his urine. The key reminder is, this kidney damage in lupus can progress silently without causing pain. That is why regular blood and urine tests are essential for lupus patients. If swelling, foamy urine, high blood pressure, or unusual fatigue appear, it is crucial to seek medical care immediately. Early diagnosis and treatment can protect kidney health and prevent progression to kidney failure. Conclusion: we have just reviewed the 10 most common symptoms of lupus: persistent fatigue, joint pain, and swelling, a butterfly-shaped facial rash, sensitivity to sunlight, unexplained fever, hair loss, mouth or nose ulcers, chest pain, and shortness of breath, brain fog, and finally kidney damage. Each one of these signs is an early warning, giving us the chance to recognize lupus before it silently harms vital organs. The troubling reality is that lupus is often called the master of disguise. Its symptoms are diverse and can mimic those of many other conditions, including arthritis, sun allergies, heart problems, and neurological disorders. As a result, many individuals experience years of uncertainty before receiving the correct diagnosis. During that time, lupus may quietly attack the kidneys, heart, lungs, or brain. Yet there is good news as well. With early recognition and proper treatment, lupus can be managed. Patients can reduce flare-ups and maintain a nearly normal quality of life. Small lifestyle adjustments make a meaningful difference. Getting adequate rest, protecting skin from sunlight, eating a balanced diet, and engaging in light daily activity can all support long-term health. Most importantly, routine medical checkups and listening to your body help detect problems before they escalate. I know that hearing about all these possible symptoms may sound overwhelming, but the purpose is not to create fear, it is to encourage awareness. Each symptom you recognize early is one more chance to protect your health and extend your years of vitality. Remember, lupus does not have to control your life. With early detection, consistent care, and mindful lifestyle changes, people with lupus can still live active, fulfilling lives. If today's information was useful, please consider subscribing to the channel and sharing it with your friends and loved ones. Every bit of support you give is an encouragement for me to continue creating more simple, practical, and accessible health content designed especially for our senior community.